Good evening, everyone. It's my pleasure to welcome you all today for Breast Cancer Awareness Program hosted by Edufam International Academy. I'm so glad to see such a wonderful turnout for this incredibly important topic. Today's event will not only raise awareness about breast cancer, but also shine a light on the remarkable work we are doing in sustainability and ecological initiatives through the Eco Visionaries Group. Let's begin with the topic that lies at the heart of our event, breast cancer awareness. Breast cancer awareness is one of the most common cancers worldwide, affecting millions of women and some men each year. Early detection is crucial and can save life. Together, we can promote a culture of support, break the stigma, and spread the knowledge necessary to save lives. Now, moving forward, I would like to introduce the dedicated individuals who will lead EDUFAM commitment to sustainability and ecological initiatives in the upcoming year. These are the leaders who will be driving forward our eco-visionary group. Mr. Nara Subramaniam will be the chairperson. Dr. Chinnu Palanevelu will be the vice chairman. Dr. Ram will be General Secretary, and Dr. Halima, Director of Operations. Mr. Narendra Singh will be the Director of Marketing. And Ms. Deepika Rawat will be the Branding, Outreach, and Promotional Activity, will be promoting activities. And Mr. Vijay Kumar will be the Director of Research and Development. Hina Mudgal will be the Coordinator for Events and Activities. Aisha Tazeen is an ambassador from KSA. Danish Nazar, an ambassador from US, and Raquel Warner, an ambassador from Jamaica, and Jaikar Sehraj, ambassador from Kuwait. Under their leadership, eco-visionaries will continue to drive forward our mission of promoting sustainable practices, raising awareness, and engaging communities in ecological initiatives. Together, we are committed to create a better, more sustainable future. Now, I'm delighted to welcome Dr. Halima Sadia, who is our national leader, mentor, coach, and director of Operation EduFam Training Services in the UAE. She will be sharing her insights. Over to you, Halima, ma'am.
Thank you very much, Asma. Thank you. And good evening, ladies and gentlemen. It's my honor and proud privilege to welcome each one of you this evening. Today is an important day for all of us. The day where we are going to discuss about the breast cancer, how we can help our sisters, those who are suffering with this, and how we can protect ourselves and how we can remove the stigma attached with this. Ladies and gentlemen, as you know that Edufam International Academy believes in sustainable lifestyle. We call it as green lifestyle. How green lifestyle is going to help us to prevent or protect our sisters from breast cancer. So we have done, like the two eminent doctors are here who are going to speak about this. We have Dr. Mahesh Abhyankar, who will be introduced in details by our MC for this evening. And we have Dr. Nandita Singh, who has just joined us. Nandita Mehrotra, I'm sorry. And Dr. Nandita Mehrotra. And they will be explaining and they will be elaborating in details that how we have to find out the early symptoms of breast cancer, how we have to take the precautions, and how we are going to save ourselves and our sisters from this. Now, how green lifestyle is going to help us? I'm going to take just 2 minutes time to highlight that why Edufam International Academy believes in green lifestyle and how green lifestyle can help us to prevent ourselves from breast cancer. So we have summarized it in 5 B's. Since breast cancer starts with B, so we have summarized with 5 B's. First thing is that we have to banish harmful chemicals. You know, these chemicals are enemy of the human body. And we have to find out that where we can have the clean environment, pollution-free environment, so that we can breathe cleaner air. More pollution, more chances of having more diseases. Then we can boost our immunity with organic foods. And it's not only important for this breast cancer, but it's important to prevent ourselves from all other diseases and illnesses. That's why we are believing that we have to go back to natural, from farm to table. Try to serve ourselves with the natural food without adding any chemicals, preservatives, and then avoid toxins, avoid pesticides and all those things. We can balance hormones naturally. And last but not the least, the most important is after a certain age, or maybe some people even the young age, they stop doing the physical activities. Either they are so busy into the intellectual activities, or they are so busy into some family affairs, social affairs, and all those affairs, and we hardly think about burning the calories through active living. This is very, very important, because whenever we visit any doctor, the first thing the doctor says is balance your weight, increase your physical activities, go to the fresh air, and live a healthy lifestyle. So in brief, we can say that healthy lifestyle is the key to prevent from all the diseases. So ladies and gentlemen, since I am here to welcome all my guests and dignitaries and the resource persons, those who have joined this evening, let me have the privilege of welcoming, first of all, our resource person, the one and only Dr. Nandita Mehrotra. Please give a big round of applause, and I request you all kindly switch on your videos, because your energy, energy passes from one person to another person when we look at the faces of the bright people here. So please switch on your video and give a big round of applause to Dr. Nandita Mehrotra. We have Dr. Mahesh Ambhyankar, whom we have to welcome from the bottom of our heart. A big round of applause to Dr. Mahesh Abhyankar. And I would like to welcome Mr. Vijay Kumar ji. Please give a big round of applause to Mr. Vijay Kumar ji. I would also like to welcome Dr. B. Ramanathan from Singapore, who is the MD of ACE International. A big round of applause to Dr. Ram. Then we have Mr. Narendra Singh ji. We have Miss Anita, we have Dr. Saman Ahmad, we have Hina Iqbal, we have Mr. Nix, we have Aisha Tazeen from Saudi Arabia, we have Shubhangi, we have Zarina Khan, and we have Sahil Raza from Kashmir. A warm welcome to each one of you. Hope that this session is going to be fruitful for all of us. Over to you, Asma.
Thank you, ma'am. Thank you for your enlightening words and for leading us with such passion and vision. Now, it's my pleasure to introduce Dr. Nandita Mehrotra, a distinguished medical profession with an MBBS and MBA, who combines a medical and management expertise. Dr. Nandita has worked extensively at the grassroots level, building and running community groups, both in India and Dubai. She is passionate about healthcare awareness and empowering communities through self-care and self-diagnosis. Her global experiences and interaction with various cultures have equipped her with a unique and diverse outlook. Please join with me in welcoming Dr. Nandita. Nandita, over to you, ma'am. I think Dr. Nandita was there, right?
A big round of applause to Dr. Nandita Mehrotra. Ma'am, please unmute yourself and present.
Ma'am, you are on mute. Kindly unmute yourself, ma'am. We can't hear you.
Hello.
Yes,
Yes.
you are audible.
Hello. Hi, good evening all.
Good evening, ma'am.
I'm unable to access my video. I'm just trying. Can you hear me?
Yeah,
Yes, we can
Yes,
hear
yes.
you, ma'am. Without
Hello.
video, you can go ahead, please.
Okay, thank you. I'm unable
Yes.
to access it. I don't know what's the reason.
No problem. Audio is clear.
One.
Ma'am, please start.
Hello.
Ma'am, we are waiting for you.
So the topic for discussion is breast cancer awareness. And as you are aware, we will be celebrating it throughout the month. So breast cancer, as you are aware, breast cancer is more common in women. It's one of the highest mortality and diagnosed cancers in women across the world. Why is this hanging my... Just a minute, please.
Can we start with Dr. Mahesh, and then meanwhile we will fix Mr. Asma?
Yes, ma'am. Yeah, meantime, Dr. Nandita fix her problem. I'll invite Dr.
Hello.
Yes, ma'am.
Dr. Nandita will get back to you. Let us fix what exactly is happening. Meanwhile, let's Dr. Mahesh start the session, and I'll contact you on the WhatsApp.
Now I'm honored to introduce Dr. Mahesh Abhyankar, a medical and pharmaceutical expert with more than 2 decades of experience. Dr. Mahesh currently serves as Vice President, Scientific Services at USV Private Limited. He holds an MBBS degree from King Edward Memorial Hospital and has made significant contributions to both medical research and community health initiatives. Dr. Mahesh, we are eager to hear from you.
Yeah, good evening all. As doctor was telling that it's a breast cancer awareness month. I think breast cancer itself, almost in 150 countries, it is the number one cancer for women, and the more than 2.3 million women are affected by breast cancers. And there are a lot of myths which I will try to clarify during my talk about the breast cancer. Breast cancer means it's abnormal breast cells which grow. It may start from the milk ducts, or it may start from the milk producing globules. And the important issue is that almost 50% of the patients, why this happens. So what are the risk factors? They are unknown. So that's one of the important reasons that the breast cancer gets undetected. There are certain risk factors which are talked about, is that they may lead to breast cancer. Some of the risk factor may be, obviously, one is family history. If somebody, a mother or from any other woman in the family has suffered from that. Obesity is currently one of the very important risk factor. So the diet pattern requires a lot of changes from the age of, let us say, 20 to almost for 50 years. So physical activity is very critical. And it is not no need to go to the gym, but around 30 minutes walk, what we call it as a power walking, that is sufficient. Another risk factor is obviously a high amount of alcohol, the alcohol consumption in certain communities, or even the tobacco use, which is very important. Post-menopausal, for maintaining the good aging, many times the hormone replacement therapies are taken. So these that can become one of the risk factor for breast cancer. And the OC pills. OC pills for a very long period of time. So nowadays the doctors are advising that after 5 years of taking OC pills, woman can take a break. And the most important positive factor which is there for reducing is the breastfeeding. Breastfeeding, nowadays the modern woman, they avoid breastfeeding, or within short period of time they switch from breastfeeding to the normal feeding. But the breastfeeding is known to reduce the risk factor of breast cancer. Now, many times the detection becomes very difficult. One of the reason is that there is a small lump, and the woman doesn't know that the lump has developed. So, breast lump is one of the very important presentation in the clinical practice. There may be some changes in the breast size, or even the skin changes seen on the breast. From the nipple, you may find some discharge, or there are certain changes in the nipple. So, in early stages, it is only lump. But if the lump is relatively becomes bigger, then it can spread to the lymph node in the nearby areas. And in a very advanced stage, you will find there is a spread to other organs like lungs, liver, and bone. So what is important is that there are a lot of myths about breast cancer, and therefore the detection also becomes very difficult. Is every lump is a breast cancer? The answer is no, because out of the commonest lumps which are there, they are totally non-cancerous. So almost 90 to 95% cases, the lump in the breast is non-cancerous. Very small percentage of patients may be having cancer. Another myth which is there is that is the breast cancer contagious? Is it going? And again, it is answer is no. It is not an infection where it will go to spread even from one breast to another breast, or from one person to another person. Is the breast injury causes breast cancer? That is another important myth. There may be some accidental damage, or there may be blow, or during the foreplay also sometimes there is some trouble. But the injury is not related to breast cancer at all. There may be injury, but many times for injury, the patient or woman goes to the doctor to meet. And at that time, the doctor tells, okay, this is an injury, but there is a lump also. So the detection sometimes happens in this particular cases. If use of anti-odorants or the anti-perspirants, again, there is no link. Many times the people have got a fear that use of this kind of substances or chemicals are related to the breast cancer. The another important myth is that the big cancer, the breast cancer is more common in the woman with a big breast. Again, there is no link to the size of the breast. It may be a smaller or mid-size or big size. There is no relationship about the breast cancer and the size of the breast. But obesity, obviously, the obesity is a risk factor which is mentioned. So automatically, it is very important is that the obesity, overall obesity, obviously the fat composition of the breast tissue is also relatively big. Now, carrying a phone, nowadays the carrying phone near the breast region or near the bras, is it related to the cancer? There a lot of research has been taken place, especially for the short period of time, but there has been no link that the radiations from the mobile phone are responsible for developing it. The long-term studies are still ongoing. We really don't know that whether this radiation will be of Now, many times the detection, one of the very important technique is mammography. And there is a lot of fear among the women that undergoing mammography. And if you do a routine testing with mammography, is it going to increase the risk? Because during the mammography, there is a lot of compression. And apart from that, there is a radiation. So now what happens if you look at the radiation amount, or if you look at the compression of the breast, there is no relationship is that the mammography will lead to breast cancer. What about relation to sugar? Because a lot of in India also and overall global scenario, the diabetes is very increasing. But sugar also does not have got any link to breast cancer. Sugar has got some link to obviously weight gain or obesity or even in diabetes cases. Do the men get breast cancer? Yes, there is a percentage that almost 1% of breast cancers are basically where the men also can get breast cancer. Almost 99% of breast cancers are related only to the woman, obviously. Nowadays, there is a modern, if you use of a fancy bras or the bras which is under wire, these are all rumors. Basically, there is no scientific evidence that the nature of the bras are going to be responsible for breast cancer. What is important is that as Madam Doctor was also telling that the early detection is very, very important. And as we go as a routine checking with the doctor, definitely for the woman, cervical as well as breast examination is becoming very, very important. The second is mammography is one of the very important tests. And whenever there is a lump, obviously doctor goes for biopsy to understand whether it is a cancerous or whether it is non-cancerous. I started my practice around in late 90s. Now, at that time, I was working as an ICU specialist, and there are a lot of cancer patients admitted. A lot of patients, footfall from Tata Cancer Institute used to come to St. Elizabeth Hospital. Almost our 20 beds were always full. I was there for almost for 3 years. All kinds of cancer cases. But from there, if you see today, obviously there's a lot of changes in the overall technology as well as the treatment pattern. And today there is the best fit available for a combination of chemotherapy as well as radiation therapy and as well as surgery. The oncosurgeons, oncologists, and the radio-oncologists as a team, they work very comprehensively on the breast cancer management. The survivor rates are very, very tremendous, very high. I have got a couple of patients which are now obviously survivor for almost 40 years plus after the breast cancer, and there is no recurrence after the full treatment. So what is important currently happening in the global platform is that the World Health Organization, since the breast cancer has got a very good treatment available, has decided that we have to reduce the death rate. So every year, the World Health Organization decided that to reduce the rate of death by 2.5%. So by around 2030, around 25% reduction in the deaths, and around 2040, almost 40% reduction in the death. Now, how this is going to happen, and the whole plan, global platform, including the each and every country, is basically by three parts. One is early detection, the another is the timely diagnosis, and the third important point is that cancer treatment has to be affordable and available to each and every patient, which is very critical. And this particular activity, I think it's an eco-visionary initiative taken by Edufaminternational along with the global other partners. It's a very, very important initiative where a lot of women will be benefited across the globe. So as a social entrepreneurs, we have to work towards this particular cause. Obviously, we can become a community ambassador. We can be a part of support group which are working for various cancers. The cancer education is very, very important because there are two diseases. One is heart disease and the other is cancer disease. These are the largest cause of death across the globe. The other important point is conducting camps at various workplaces or conducting camps at the community levels. And we have to, the cancer survivors, they have to share stories across the platform so that the confidence is built up in the other cancer detected patients. And donation is also very important because it's a Herculean task. It requires a lot of manpower, methods, as well as it requires the money also. So those who are want to help, they can help the cause of this particular cancer. It's a classical example. A couple of days back, I think Ratan Tata, and he contributed to the cancer cause in a very, very great amount. The Tata Cancer Institute started in Mumbai. I think millions of cancer patients have been treated. And now there is a chain of Tata Cancer Institute also available, doing a lot of social and charity work. CSR is very, very important. If you save the life of the person, or if you give quality of life of the people, it will be the best thing what we can do. I think these are some of the points which are very critical related to the breast cancer. So my final point is obviously Sarve Sukhinas Santu, Sarve Santu Niramaya, Sarve Badrani Pashantu, Ma Kashid Dukhmapniyat. Everybody should be happy and everybody should be healthy. And I think the pain of cancer person has to reduce in a drastic manner today as well as tomorrow. Thank you.
Thank you very much, Mr. Mahesh. It was really wonderful presentation and big round of applause to you. Yes,
Thank you, Dr. Mahesh. for those valuable insights and letting us know about breast cancer in detail and making us aware and how we can overcome it. Thank you so much, sir. Now, I would like to invite Dr. Aisha Tazeen, our ambassador from KSA, who has a wealth of experience as an educator and administrator. She has been a teacher and educator for over 25 years, holding such roles as a principal and a vice principal. She is a Toastmaster, blogger, podcaster, and co-author. We would like to hear from you, Dr. Aisha Tazeen. Over to you, ma'am.
Before that, can we ask Dr. Nandita if her issue is fixed? Dr. Nandita? Dr. Nandita? Yes, Aisha, over to you.
Assalamu alaikum and very good evening to all the presentees here. I would like to take the opportunity at the outset to thank Dr. Mahesh for his very positive and very inspiring talk. And there were many myths even I did not know before your talk. In a very short talk, you have given a lot and lots of inspiration to all the women across the globe. I'm sure those who are watching globally will definitely benefit from your straightforward statements, true statements. Usually, we have a phobia all across. Let me be very honest to you that commercialization has penetrated even in the medicinal field. So doctors are not coming up with the correct statements, and there are a lot of myths among the people due to lack of awareness. But kudos to your simplicity and generosity that have very clearly, crystal clear way. You have represented everything, and all the misunderstandings and the myths are really rectified. A very dear friend of mine is also in the same stream. She's also suffering. So I have now full confidence to energize her, to elevate her spirits. And definitely I shall try to take out her from that trauma, inshallah. So this has really energized me. Now coming to the platforms like this, which Dr. Halima ma'am is organizing, these are truly a kind of awareness programs in which we energize and rejuvenate our professionalism, and we create sustainability by taking up such issues and the issues of importance to all of us. I would like to thank the platform, Edufam platform, for giving me this opportunity to speak. And thank you very much. And I place on record the efforts done by Edufam and the team. Thank you very much.
Thank you, Aisha ma'am. Now I would like to call upon Hina Iqbal, who has an impressive career spanning both education and administrative roles. Hina has taught as a lecturer in the Department of Zoology and worked for 13 years as the administrative head in Food and Beverages Services. Currently, she is the PGT HOD Biology at Allen House Public School, and she is also involved in mosquito-borne disease prevention research. Hina, we would like to hear from you. Over to you, Hina.
Assalamu alaikum. Good evening, all. I would like to thank Dr. Sadia for bringing us together in this wonderful platform of sharing and upskilling our knowledge. Dr. Mahesh, it was a wonderful session you've given. But, sir, I had two questions. Sir, you said that radiations, you have cleared the myth of many, there were many cobwebs in our mind regarding the outfit and the undergarments and all. But, sir, I had one question. What do you think is the role of mutation? And do the radiations coming to the Android phone, are they not causing mutation? And because most of the time the ladies are carrying their mobile phones, and now in this era, in this, the generation is having more of lack of physical activity, as well as I think the radiation is one of the causative agents. And sir, I would like to ask what is the role of mutation? And because we are talking about sustainability, so much of adulteration in food, And the kind of packed food and canned food which now we are consuming, even the Maggi which we are having, even the food colors which are added to the condiments and spices. Sir, what is your take on that?
Yeah, I think before the birth, actually, if there is a genetic mutation, there are certain genes which are linked to breast cancer. There is no doubt about that. BRC1 and BRC2 kind of a genes which are related to the mutation in that particular genes, maybe there is an increased risk of breast cancer. In terms of mobile, what has happened is that there are in certain communities, even the ladies keep the mobile in the bras, right?
Yes,
So
sir.
now that kind of a study which has done in that population, where they have studied and keeping mobile near the bras and then maintaining it for let us say 5 years, 10 years, they have not found out that there is a increased substantial risk of keeping that and the risk of overall as a mobile as a radiation. Even there are studies going on brain risk of cancer, but the cancerous condition risk is not to that particular extent which is proven. There are other things which are definitely proven. There is no doubt of that. Learning ability is reduced or attention span. So there are a lot of studies that mobile has got what we call it as a digital detox. So over digitalization definitely has got a negative impact overall part of the body. But regarding the cancer, I think the data is still limited. It may take time for because cancer takes very much time to develop. It is
Yes, sir.
not the
Sir,
immediate.
one more question I had, that what is the role of our diet in the carcinogenesis happening in the body? Because this is a simple phenomena where the cell contact fails. Like
Yeah,
it,
absolutely.
yes, sir. So, what is the how? Don't you think the adulterants and the food colors and the pollution which is percolating in the water has a role which is causing cancer?
Yeah, there are carcinogens which are already there are chemicals and substances which are very well known for cancerous condition. There is no doubt about that. And they are responsible for also, if you look at GI cancers or any other cancers, there is a definitely role to play. The diet has to be for any person. The diet has to be classical protein, carbohydrate, fat properly, and vitamin, minerals, and 2 liters of water. So balanced diet is very very important for immunity also. So if you want to fight out any disease, whether it is an infectious disease or whether it is a cancerous condition, immunity has to be strong. The diet has got a drastic positive role on building the immunity. So if the diet is adulterated or the diet is not nutritious, then definitely it is going to reduce the immunity. And even if the small initial precancerous condition also can trigger into cancer in a very fast or advanced manner. That is very, very important. And yes, chemicals are responsible, but typical to breast cancer, where the duct milk producing lobules and the ducts. Now, there the classical link of dietary thing is not mentioned, but obesity. Obesity increases the risk of breast cancer, and obesity obviously linked to overeating or the changing in the metabolic pattern and diet pattern. So diet you can consider, it is linked that the chemicals may be or the obesity may increase the rest of breast cancers as you are talking. But nutritious diet will reduce the risk. It will build up the immunity, and spread will be slightly localized.
Okay, thank you, Dr. Mahesh Abhyankar. Now I think Dr. Nandita is ready to share her knowledge and experience. Dr. Nandita, please.
Hello. Hi, can you hear me?
Yes, we can.
Okay. So I am not able to on my video still. I'm going to just speak. Can you put on my presentation on the screen? I'm not able to access it here. Can we start?
Yes,
Hello?
yes, we can. It is on the screen now.
Okay. Yes. So good evening all. Sorry for this confusion. I'm not able to access my video, but I have my presentation here. So as we have very eminent speakers who have spoken earlier, my presentation is much the same about breast cancer. I would quickly take you through the journey. So basically, I begin with the breast cancer. Let's make ourselves aware. Let's make each other aware. Create love, hope, care in this treatment and cure for cancer. So I begin with the anatomy of the breast. As you see in the presentation, our breast is lined by the skin, which has some subcutaneous fat. There are milk ducts which carry the milk, and there are lobules which are composed of several alveoli where the milk is formed. So this whole system in the breast is connected. Several of these ducts open into the nipple, and the areola is the area surrounding the nipple. So this is the normal breast anatomy. What happens in cancer is these cells start proliferating either in the milk ducts or in the milk lobules. They start proliferating, and then they start expanding either within the ducts or outside the duct. So depending on how they are proliferating, we have to figure out what is the stage grade of the cancer. The earliest way to check is to check yourself and do a self-exam repeatedly. Early detection will help in better prognosis, in early detection of the disease and better cure. The breast self-exam can be done in two ways. First is to just sit in front of a mirror and observe both your breasts. Look at any changes on either side, the right or the left. Look at any pigmentations, in any dimpling or discharge or any deformities on the breast, either breast. The second way is to start palpating. So if you are palpating your right breast, you use your left hand, and vice versa. If you are palpating your left breast, you use your right hand. And the other hand, put it behind your head so that your area is tense and you can feel it. And the way to palpate it is you begin from the axilla, the fold between the arm and the chest, and then you start palpating in circles. You do not poke your fingers. You go horizontally, softly in circles, trying to figure out if there is any lump or any protuberance you can feel. So breast self-exam is a very good way of self-diagnosis, understanding your body, and then going to the authorities for a checkup. What are the signs you can see if you begin to start having the symptoms? So the early signs you can observe are, as I said, there will be some nipple changes. There could be some discharge. There could be a lump on the breast. There could be discoloration in the breast, pitting of the breast, or they can be basically lymph nodes in the axilla. So it's this slide also says the same. Lymph node changes, breast nipple changes, areola. There can be changes in the areola area around the nipple. The nipple can be inverted, retracted. There can be dimpling. There can be discoloration. So we can go to, I've completed this part. There can be discoloration, changes in nipple, dimpling or pitting. Now, it's not necessary that always breast cancer has to be associated with a lump. As I mentioned before, changes in the areola, changes in the nipple can also lead to, our caution for breast cancer. So changes in dimpling or puckering, loss of sensation in any part of the breast, nipple discharge, retracted, inverted nipple, redness of the skin, orangish coloration of the skin can also indicate signs of breast cancer. So what are the risk factors for breast cancer? As we have spoken earlier, females have a greater risk for breast cancer. 99% of the cases are caused in females and about 0.5 to 1% in males. Age is a risk factor. In age, we see the age at which the woman got her menarche, that is her first menstrual period. We also look at the menopause, the age at which she achieved menopause, or what is her current age. So all these age factors play a big role in a woman developing breast cancer. Also, we see the family history. Is the mother or a sister or any woman in the family having a family history of breast cancer, or even a first degree relative having a history of family of breast cancer. Then personal history, as mentioned earlier, is very important about your dietary habits, having a balanced diet, having lots of fruits and vegetables, reducing and increasing your moderate activity per day. So it is recommended to have about 30 minutes of moderate activity every day. Also, if you are postmenopausal, you have to be careful that you're not gaining excessive weight. Obesity is also a cause of most diseases. So we need to keep our BMI in check. A BMI less than 30 is considered good, 29.9. And and with menopause, we do get these changes in women. So we do tend to gain weight. So it's very important to understand our body and start working on it through exercise, through diet, and a lifestyle change. Risk factors. So there is a breast cancer risk assessment tool was created. In this, again, these risk factors, as I mentioned, early age of menarche, age of the woman at her first childbirth. Was it less than 20 or more than 35? Number of births. Does she have one child or more? Breastfed. Has she breastfed her children greater than 1 year or not fed? Current age and age of menopause. So a lot of risk factors have been, there have been tools and assessments done, and these are some of the reproductive risk factors. Then we come to the next slide, which is about hormonal risk factors. Okay. So hormonal risk factors are if the woman is postmenopausal, has she been on oral contraceptives as mentioned before? Has she been on any estrogen replacement therapy or estrogen and progesterone replacement therapy? Does she have a high blood prolactin level? Does she have a previous history of biopsy? And in that biopsy, did she have atypical hyperplasia or LCIS, which is lobular carcinoma in situ? Other risk factors, according to BCRAT, are family history, as I mentioned, mother and sister, or first degree relative, a Jewish heritage, history of a benign previous lesion, as I mentioned before. Mammographic density is another thing to consider, and gene mutations, BRCA1 and BRCA2, and PALB2. There are several genes. We are every day undergoing research, and there is yet to know a lot about breast cancer. We are not there completely, but yes, we know that genes are also an important factor. Then other factors, as I mentioned before, lifestyle. The types of breast cancer. Breast cancers can be, as I mentioned before, they can be invasive. Ductal cancer, this is the most common type, initiated in the milk ducts, invades the surrounding tissues. Another form is invasive lobular cancer. As the name suggests, it initiates in the lobules. The lobules are the milk producing glands, more difficult to detect. May I have the next slide? The third kind is the ductal carcinoma in situ. These are non-invasive. That means in situ means they remain within the duct where they have been formed. They do not outgrow that space. And then another type are the triple negative breast cancers. These lack estrogen receptors. They lack progesterone receptors. They lack HER2 proteins and are generally more aggressive. HER2 positive breast cancer. Over here, there is an overexpression of the HER2 proteins. Luminal A, hormone receptor. These are hormone receptor positive. Either they are estrogen positive and or progesterone receptor positive. These are usually less aggressive, but carry a better prognosis. Luminal B are similar to luminal A. These are again hormone receptor positive, high grade, more aggressive than A. Inflammatory breast cancer, these are rare and aggressive forms. These block the lymphatic vessels, and as a result, they lead to the swelling, redness, and discoloration. Paget's disease, it involves skin of the nipple and associated with underlying ductal carcinomas. So now we come to the staging of cancer, of breast cancer. Staging, the most common way to stage breast cancer has been TNM classification, where T stands for the tumor size, N stands for the nodes, and M stands for metastasis. So this has been categorized as TIS is tumor in situ, where the tumor remains within a confined location. T1 is when tumor is less than 2 centimeters. T2 is when tumor is greater than 2 centimeters but lesser or equal to 5 centimeters. T3 is when it is greater than 5 centimeters. And T4 is any size with direct extension to chest wall or skin. Then we come to the nodes. The nodes can be regional or distant lymphatic nodes. N0 is when there's no regional lymphatic node involvement. N1 is when there are METs to 1 to 3 axillary lymph nodes. N2 is when it is to 4 to 9 axillary lymph nodes. And N3 is when METs to 10 or more axillary lymph nodes, or involvement of supraclavicular or internal mammary lymph nodes or distant lymph nodes. And M is metastasis, distant metastasis. M0 is no distant metastasis. M1 is metastasis to organs like lung, liver, and bone. So as I mentioned before, this is the same thing repeating. Ductal carcinoma in situ, stage 1, the lesion is less than 2 centimeters without lymphatic node involvement. Stage 2 is 2 to 5 centimeters with or without lymphatic node involvement. Stage 3 is locally advanced cancer with. So understanding staging. Now, why do we need to understand staging? It helps to understand the prognosis of the disease. So the ones in situ are in prognosis because they do not spread. 100% survival rate after 5 years. Stage 1 is very good prognosis, 90 to 100% 5-year survival rate. Stage 2 is 70 to 90% 5-year survival rate, generally good prognosis. Stage 3 is more variable prognosis, 50 to 70% 5-year survival. And stage 4 is metastatic, poor prognosis, 20 or less 5-year survival rate. Now, grading. What is grading? Grading actually tells us how deviated or abnormal these cancer cells are from our normal cells when we look at it under a high-powered microscope or something. How rapidly, and this gives us an indication how rapidly these cancer cells might grow or spread. Higher grade in most common system of grading is Nottingham or Scraff Bloom-Richard method. This evaluates 3 factors: the tubular formations, nuclear pleomorphism, and mitotic activity. So each factor is scored from 1 to 3. The total score ranges from 3 to 9. Higher grades have obviously worse prognosis. Higher grades may require aggressive treatment. Now, what are the diagnostic tools which we commonly use for CA breast? Mammography is the primary screening tool. It uses low X-rays to detect abnormalities even before they are palpable. Breast ultrasonography, it is followed generally by the mammography and helps to differentiate between a solid mass versus a cystic lesion. So BIRADS is the breast imaging reporting and data system. This is a common universal system, a classification system used to categorize breast imaging findings, primary for mammograms, to standardize reporting and management. The BIRADS 0 to 6 is the rating. Then magnetic resonance imaging is for detailed imaging in high-risk cases or pre-surgical planning when you need precision areas and precision. Biopsy is the definite method of diagnosis. It can be done with a fine needle. It can be done with a core needle biopsy or a surgical biopsy if it's a big area to be biopsized. Histopathological analysis of biopsy tissue help to determine the type and grade of the tumor. Immunohistochemistry is the testing samples for hormone receptors. As mentioned earlier, a lot of these cancer cells, they may be estrogen positive, estrogen negative. So hormonal assessment and HER2 assessment is essential for these cancers. Molecular profiling and estrogen receptors, hormone receptors, estrogen positive respond to hormonal therapy as I mentioned. Progesterone receptors are similar to estrogen receptor positive cancer cells. And hello. And HER2, what is HER2? Is the human epidermal growth factor. This promotes growth of cancer cells. Ki-67, a proliferation marker, indicates how quickly cancer cells are dividing. Higher levels suggest a more aggressive tumor. BRCA1 and BRCA2, CA115-3 and CA27-29 can be elevated but are not specific markers. Loads of research has been done, as I mentioned. More is underway to better understand the disease. Oncotype DX and Mama Print are genetic tests to assess the risk of CA breast recurrence. These help you in treatment modality. So, in a nutshell, now I'm going to bring my presentation to an end. How can we prevent breast cancer? By regular breast self-exams, controlling your weight, maintaining a BMI less than 25, regular moderate exercise at least 30 minutes a day, healthy diet including fruits and vegetables, mammogram screening. It is recommended by WHO 40 to 49 years females should undergo mammogram screening individualized depending on their situation, but above 50 to 69, it is recommended to undergo screening every 2 years. And if any suspicious lesion is found on mammogram, it should be followed by an ultrasonography and an ultrasonography guided biopsy. Early diagnosis and prompt intervention help in better outcome for the disease. WHO has started this Global Breast Cancer Initiative, GBCI. It was launched in 2021, and the aim is for 20 years, between 20 and 2040. The aim is to reduce the breast cancer mortality by 2.5% per year. It will prevent, it will prevent 2.5 million deaths globally for women under 70. That is the aim, according to WHO. Thank you for being patient and listening to me. And I hope they were takeaways from my presentation and I could add value to your information, knowledge, awareness about this disease and its outcome and treatment. And my suggestions: be aware, be proactive, act soon, forward to your loved ones, and take care. And thank you for your patient listening.
Thank you, ma'am. Thank you for the insightful information on breast cancer. Your clear explanation of diagnosis and treatment options were incredibly helpful. I appreciate your support and guidance on this important topic.
Thank you.
Now I would like to invite Mafia Kayani, who is going to share thoughts on the importance of breast cancer awareness, self-care, and critical role of support systems. Over to you, Mafia Kayani.
Yeah, hello. Thank you so much. Good afternoon to all of you. For me here, it's good afternoon.
Good afternoon, ma'am. Good afternoon.
Yeah, she is from UK, so that's why she's saying it is afternoon for her.
Okay.
Yes, Mafia.
So, yeah. So just to thank you so much for all these doctors as well. Thank you so much to Ma'am Halima, who is always promoting the people and, you know, taking the recent issues or all those scenarios, all those scenes, like highlight them very well, and whatever the recent issues are going on in the society. So thank you so much, ma'am, once again. I'm so sorry. Just shall I take one breath? Because
Yeah.
from downstairs to come upstairs, after recovery, it also bring, the just one sec.
So Mafia is also one of those brave women who have recovered from this, and she is really a great example, or we can say a great model for all the women across the globe. So Mafia, congratulations. We are proud of you.
Yeah, thank you. Thank you so much, ma'am. So, yeah, that is better. Hope so for all of you.
Yes.
And you to invite me here on this platform, definitely through which we can spread the awareness regarding this, which was totally new for me in my family. Never thought it could happen with me as well. But sometimes we do realize, like, we do not know why Almighty He chose us for such kind of things, but many other aspects are also behind them which we cannot realize. But with the passage of time, then you realize when the consequences are there, you then realize like why you've been chosen for it. But definitely through this platform, I'll give one message to all of the ladies, as it's been becoming really common. Sometimes we do not realize why is it happening. But these respected doctors, as they highlighted in their presentations, obviously it is stress. It could be lifestyle, especially because the life is becoming so, you can say it's so busy that we ignore ourselves. In my part, I do not know what it was a reason. It could be a lifestyle as well, stressful working hours, or ignoring. Sometimes, we moms are having to do it for the rest of the family members, but we ignore ourselves. We say, no, everything is going on fine with us. But not true. You are also at the top priority in the family. When I came here last year, so at that time it was diagnosed, and I feel I was the luckiest one. Like it was diagnosed at the very early stage with triple negative. As doctor, she said, it's too aggressive as well. Triple negative. Aggressive in a sense means could be spread very easily and quickly. To be spread out, because within 1 or 2 months, then I realized my weight, I was having too much weight loss, but kind of thinking maybe it's because of my migration or whole shifting from UAE to UK. So maybe that's the reason which is causing my health like this. But luckily I found it, and then immediately my treatment has been started. So the things which I'll say must through this platform do spread the awareness, the awareness of the beginning stages. But now, as Alhamdulillah, I have recovered. But still, some of the follow-up, my appointments have been going on, but side effects are more. And there should be some of the same kind of, ma'am, I'll request to you, keep going on with same kind of webinars in which other family members should also be the part of it. How can they tackle with this kind of a patient as well? Because this is also one disability. We consider it here like one disability in a person, because you can't go like a healthy man as you are before this. So later on, your big moral support is always your family. If you are the luckiest one, your family members would definitely support you, because you need that kind of person who could make your morale very high. And then you realize that, yes, exactly, you are having strength to cope up with this disease. So at that time, my morale was really high, taking everything as if normal, or if it's been going on, that's fine for me. I can do it. But later on, at the end stages, large stages of my treatment, it was really hard. Then I realized, yes, do the people say about the medicine? It is like, you can say, one of the day I was thinking after my injection, which they give. So after that injection, honestly speaking, I was not having a hope I'll awake alive or not, or what will happen with me. Because one time when I was fainted, that gave me kind of mistrust on my whole body, like it could happen at any time. So the thing is, as side effects are going on, we should do inform in our surrounding people as much they could help to that cancer patient, either regarding in their cookings, cleanings, this kind of help, and definitely the lifestyle. So each one of us are to, take care of these things, and through the platform we can say to the other members as well, mentally, because mentally it also affects a lot. So whomsoever those people I found which were really appreciating me, that was boosting up my morale and my strength. So slowly now I'm back onto the track, and back on the track means it's slightly difficult for me. Thank you so much, all of you. And I'm really feeling, yesterday I was having full body aching and all, but right now, the moment when I'm expressing myself here, and to especially look at my the greatest mentor, Ma'am Halima Sadia, so I feel like nothing is with me. I'm really fresh, I'm good, I'm same like before. So thank you so much, ma'am. I would have to speak more about it, but time is short. And here the life is also really busy as well. The best thing is everywhere it's the same. We all are working hard for our, livelihoods, and for our all the daily routines to tackle with the family and the jobs. But the best thing is, yes, we should take out the time for ourselves. So thank you so much, all of you.
Thank you, Mafia. Thank you. It's really great. And Mafia is a girl who is so brave, courageous, hardworking, that she is taking care of 2 children, school-going children, and she herself is a teacher in the school, and she continued working. That is really when I first time came into contact to Mafia and she informed me about this, then I was thinking she must be taking rest on the bed, and she must be 2-3 people must be around her to take care. But when she showed me that how she is spending her time going to the school, doing the job, doing the household chores, that was really marvelous. Thank you very much, Mafia. And that has given you real recovery and fast recovery. I must say that when we have full zeal of living a normal life, a regular life as we were living before. So that gives us that great.
Thank you so much. Thank you, ma'am.
Yes. May God give you more courage.
Yeah,
yes,
sure.
Ladies and gentlemen, this is something, the fact of life, that finally at the end of the day, your family is besides you. Yeah, so Mafia's husband was throughout in this journey with her, and I know, and Mafia's sisters have come forward to take care of her kids back in Pakistan. So that was really something very great on her part. So really, we need the people in life. More than anything else, we need the people around us. And
yeah,
thank you very much, Mafia.
Thank you so much, ma'am. Thank you. Okay, so thank you all of you. Or at any time, if more seminars, webinars are there, I will do take out the time here, like for you people, this kind of awareness, or regarding, other kind of things as well. How did I suffer it, and then later on you come out of it? So that's also very important for those cancer patients, because at any time they need a lot of help and rest. So it's only rest which can cure them. So through the doctors as well, through these webinars also, we can spread this awareness, because getting really common. So we do not know, because in my family history, nothing was as such. And more being a mom, I was worried about my kids. So I was not at all thinking about myself. Like whatever happened, it happened. Now nothing could be changed, but it should not be in my next generation. So Alhamdulillah, in that one also, all the tests have been clear. Genetically, nothing is there which could be transferred into my kids as well. So thank you so much. And I must say to ma'am, because it's a quite long journey. So because of ma'am's appreciation, I was so good enough to do, to take out my whole potential in UAE. So that was my experience, which is to bring me here and make me successful in this country as well. And obviously I'm over here. So behind me, professionally, if you say that's ma'am is behind me. So thank you so much, ma'am. Jazakallah. And I really feel good and impressed when even still on this level, you are, growing up day by day, and mashallah, keep growing on, same like this, and your family as well.
Thank you,
Thank you.
Mafia. God bless you and keep smiling always. And yes,
sure.
yeah, God bless you and your family. Take care.
Thank you. Take care. Thank you, all of you. Take care. Bye-bye.
Bye.
Thank you, Mafia, for sharing your powerful journey with us today. Your strength and resilience in overcoming cancer are truly inspiring. Now, I would like to invite everyone to join us for a networking session where we can discuss our experiences further and connect with each other. So yeah, it's a great opportunity to share insights, ask questions, and support one another. So yeah, we are eager to.
Now everybody can unmute themselves and then share.
Before networking, I would like to, Dr. Nandita was not able to see her video. Maybe in that view section, she must have said hide self view. Because that's what I had done by mistake. So when you go to view, there is a place called hide self view. In that case, you will not be able to see your own video.
My own video?
Now, Dr. Nandita was not able to see her video. No?
Okay, okay.
So in that view, the top of this menu view is there. And one place where it says hide my self view. And if you click that by mistake, then you have to say show self view.
Yes,
like I also done that yesterday. That is the reason she was not able to see her own video. Even I was not able to see my video because suddenly I forgot that yesterday I had done that while recording on video.
Yes, I think Dr. Nandita will take note of this. And Dr. Nandita, thank you very much for sparing your time. I think now most of the things are very clear. And Mr. Narendra, do you want to share something with us?
It's fine. It's very clear. Dr. Mahesh has briefly given complete helicopter view. Dr. Nandita has gone little bit in deep. So absolute clarity on that.
And,
thank you so much,
and
Dr. Mahesh, Dr. Nandita, and Madam for sharing her experience, how she is overcoming.
Yes.
That's great.
That was really a great story that Mafia has shared. And I'm really like, when the people, they share such type of things, so they are a little nervous or.
So I will say, ma'am, one more point.
Yeah.
I have known some people, those who have had this breast cancer, some ladies in our circle, family circle. So what I have done, whenever somebody has come up, I made her to talk to two ladies, those who are absolutely healthy now, after 5 years, 10 years, 20 years also. So those who were down initially when they were detected, when I made them to talk to two ladies, they got a lot of confidence and they also went through the process and they are okay.
Yes.
So this helps a lot. When you talk to somebody who has gone through, that boost your confidence of recovery also. And it is all about faith.
Very true. Very true. Yes. Dr. Kashif, you joined very late. Are you there? Do you want to share something? What was your expectation from the session?
Yes, of course. Actually, I was traveling somewhere. So that's the reason during driving, it's the authorities impose 10,000 fine if they are finding anybody. using multimedia or other sort of things. I most probably next session I'll actually it's the Indian Standard Time, I thought, because that I marked this appointment in my diary. That was scheduled right around about 4 o'clock.
Yeah, it was UAE 4 o'clock. That is India's 5:30. So next week we are going to have a very special topic, and that is sustainability lifestyle, and how small practices of sustainability are going to help us to live healthier and happier. That's the topic for next week. We are still, we have received the speakers' names, but we are still open. If the people, they want to share their experiences, expertise, if they have worked in the field of sustainability, they are most welcome. So they can WhatsApp us with their desire to share their experiences. So every week we have this complimentary program, and this complimentary program is for 1 hour. Sometimes we take more than 1 hour, but we try to complete it within 1 hour. So I'm sharing my WhatsApp number. Those who are interested to be the part of this sustainability practices session, you are most welcome. Please share your name with your expertise. Thank you very much, everyone. Now, Asma, please propose vote of thanks, and then we'll wind up the session.
Yeah, before we wrap up, I would like to thank each and every one of you who has participated, the speakers, Dr. Mahesh Abhyankar, Dr. Nandita, and all other speakers, Dr. Aisha Tazeen, Hina, and yes, of course, Mrs. Mafia, who is a cancer survivor, and all the participants who has taken out time to attend this Zoom meeting. And yes, with that, I would like to wrap up today's session and thank you all for being a part of this impactful event. Let's continue spreading this breast cancer awareness and promote sustainability within our communities. So yes, we look forward to see you all in the future event. Thank you, one and all.
And please join our Eco-Visionary group so that you will get the information on time, because we share all the information in Eco-Visionary group. It's not possible to share individually to each and every one. So I have shared the link of Eco-Visionary group. Please join that to be the part of this sustainability group. Thank you very much, everyone. Thank you, Vijay-ji. Thank you, Dr. Sir. Thank you, Asma. Thank you, Asha-ji. Thank you, Nix-ji. Thank you, Saman. Thank you, Nandita, Dr. Nandita, everybody. Thank you very much. And see you next week on the same time. 1 p.m. UAE time and 5:30 India time. The certificates will be shared in the group. Please join the group so that you can get the certificate of your speaking slot. Thank you.